Today we've got Stephanie from Bridgercare on the show. Welcome to the show, Stephanie.
Hi, glad to be here.
So for most of the viewers, this will be new content. So let's start with basically what Bridgercare has done, and then we'll move into what's changed based on how COVID's affecting healthcare. So give them a brief overview of what Bridgercare does.
So Bridgercare is the local nonprofit grassroots family planning clinic in Bozeman, Montana, and we serve South Central Montana. So the greater Gallatin and Madison and Park County areas. And we provide basic family planning services in addition to advanced reproductive health services, like screening and treatment of cervical cancer and breast cancer screening and treatment. And then we also offer some primary care. We brought on a medical director in 2017, so we've been able to expand our services with the addition of our OBGYN on staff. And we do offer, I think, probably the key mission that we do is that we offer a sliding fee scale. So our sliding fee scale, you can be someone who makes $0 a month, you can be someone who makes $1 million a month, and you're welcome at Bridgercare and you pay according to your income. 80% of our patients are on our sliding fee scale, so there's a lot of folks taking advantage of that. And another great thing is that you can have insurance, you can have Medicaid, or you could have neither of those things, and you're welcome here. So often people think, oh, if I have insurance, I shouldn't be taking a spot at Bridgercare. But it's actually helpful for us to have you come in with your insurance because your insurance will reimburse for that annual exam or that service. And that reimbursement is going to help the next patient. And then we also see undocumented individuals, and it doesn't harm their ability to apply for citizenship. Eventually, if they wanted to do that, our federal reporting just requires that we report what services we do. And so we'll see individuals as well who aren't documented. And then we do also provide something that's very important to us is that we provide LGBTQ affirming care. So our LGBTQ, our services are inclusive of LGBTQ individuals. We offer trans care as well. We started that a few years ago. And then we do offer a training for healthcare workers in the community to learn how to be more inclusive in their healthcare practices. So anyone from chiropractors to dentists to family practitioners can learn how to incorporate LGBTQ friendly services into their healthcare. So that's just a little overview.
Yeah, that's really intriguing to me because I think when you talk about reproductive health, often it's what you would consider to be a female clientele, I would guess. And I suspect that you also see plenty of males, but then also to be LGBTQ basically covers everybody in reproductive health.
Right, exactly. We actually see about 10% of our patients identify as male, which is pretty high for a family planning clinic. I think it says a lot about our providers. They're very welcoming and encouraging of people of all genders. Our non-binary clientele make up less than 1%, but our numbers are growing in that group as well. The men are usually coming in for like STI screening each year or even their annual exams just to have like their annual blood count, like their CDC, finding out their cholesterol, if they need a physical for a school sport or to join a fitness facility. Sometimes they need to do that. So we do see a lot of men, and I think you're right. I think a lot of people think of reproductive health as just a women's clinic, but we see people of all genders.
Okay. I think the identification of gender is where our brave new world that we're moving toward will be far more interesting and inclusive.
Exactly.
I know for a fact, I go to the bigger cities, it just breaks my heart at the number of kids, in particular minors, that are kicked out and on the streets because of how they identify themselves. And we're going to move into a much better place in the future, I hope.
Yeah, absolutely. That's our hope as well.
Yeah. So, you know, when we've had other things like September 11, we had these dates, but sometime in 2020, we've had COVID-19 hit.
Yes.
And really affect our society. So how is that affecting the work that you're doing at Bridgercare?
Yeah, it's affecting us in a lot of ways, like any business in Montana, in the United States, and the world right now. We I think like everyone else saw a little dip in demand during the shelter in place. People just unsure of like what was open and what wasn't. We immediately went to telehealth within a few days of seeing our numbers go up and evidence of community spread in Gallatin Valley. We were offering telehealth services. So even before the shelter in place was announced, knowing that our patients may not feel safe accessing services in the clinic. And since June, we've increased our in-person visits more. So we're adding more and more services where we're seeing patients in person. And now we're just back to our regular seeing patients in person as needed at full schedule. So it's been, if that didn't make sense to you, it's because nothing makes sense right now. And it's been a constantly evolving process. And I think any business can attest to the amount of change that you have to make with each phase or with each new body of evidence around like PPE and what we're supposed to be doing would in normal business circumstances take 3 to 6 months to implement, and we're implementing them in a week's time with a day's notice. So like any other business, we've had to change our procedures and our processes every 2 to 4 weeks based on what we understand to be evidence of best practices at the moment, knowing it will probably change at any time. And that, so that on just the business and operational side, but in terms of our mission, we are seeing more patients needing our services and more demand. Our numbers are up in July over last year, and we anticipate to continue to see that. We're seeing a lot of patients who, when you lose your employment, you lose your benefits, and that often includes your health coverage. And because they're so understandably focused on getting on unemployment and making sure they can make rent and buy food and those necessities, often applying for Medicaid falls by the wayside. So they're coming to us to meet their immediate needs around healthcare, which might be they don't have monthly insurance to cover their birth control, or they know they need this cervical cancer screening that they can't afford now. So they're coming to us to meet their immediate needs. And while they're here, we're helping them with enrollment. We have certified application counselors on staff here, and we're able to enroll patients in Medicaid without them having to go and get their documentation, like their social security cards and things like that, documented and approved by the state. We can do that here as certified application counselors. So we're trying to help our patients in lots of different ways, not just by providing the healthcare, knowing that everybody's really doing their best in a really unprecedented time, and that they can't all do it all at once.
Mm-hmm. So if you had to guess, like if pre-COVID was 100%, are you running at like 200% capacity by adding telehealth and adding the people that can intake Medicare or Medicaid and stuff like that?
Yeah, we
300.
haven't, I mean, our poor staff, we haven't added any bodies because it's also tricky to recruit and hire right now. So we're doing our best to do it with the staff that we have now. And yeah, it's really busy. We're very busy. And I would say that we've just been kind of constantly adapting and doing what we have to do to make it work. And we'll see what winter brings, and maybe we can hire, and maybe we have the capacity to do that. Our community's been very generous, so any money that we are not making that we would normally make off our clientele with the loss of insurance coverage and decrease in people's income, we're definitely seeing our community is stepping up and supporting that. So we wouldn't be here without the support of our community. Absolutely.
Mm-hmm. Wow, it's pretty amazing what I think what you're talking about for daily and weekly adaptations. I've always said if you can't adapt, you're going to be like the dinosaurs, you'll be extinct.
Mm-hmm.
But daily and weekly adaptations definitely probably a little bit on the stressful side of life.
Yeah, I mean, the staff, like sometimes you're like, we're making another change. Everybody hang in there. I think though that there's something about feeling like you're part of something good, and that's motivating right now when there's so much uncertainty. I think, and you can read about a lot of this, just how we're all processing this COVID crisis, but having a call to action and knowing that you can be part of making things better and helping people is motivating. So we just hang on tight to that one.
You know, the temptation is to say that's such a great wrap up. Is there anything we're forgetting, or is that really just where you're at?
Yeah, we are committed. We are committed to our patients, and we are going to make this work no matter what. And I have to say, again, it's because of our community and organizations like Montana Shares that support us that we're continuing to meet an increase in demand. So,
Okay,
can't
wonderful.
complain.
Thank you for being on the show, but also just thank you for the core work that you're doing in the community and supporting everybody in the community that needs it. And that's invaluable. I appreciate it very much.
Well, I would say that's the staff for sure. So I'll pass that along.
Okay, great. Well, thank you very much. Have a great day.
Thanks, Bill.